Hi, Dr. Scott Jensen here. There has been a lot happening, and I think that we need to take a step back and look at a 30,000-foot view. We could think about Tucker Carlson leaving Fox News. We could think about Don Lemon being fired from CNN. There are so many things, but I really think that if we just listen carefully, we can almost hear that chop, chop, chop of an axe of accountability, hacking away at these conduits, these pathways, whereby so much corruption and control and fear and contempt was imposed on our lives over the last 3 years. I want to start small and I want to get big, but there's quite a bit here. So here we go. I'm going to go fast. I'll certainly try to make certain you understand my resources. The first comment, let's start small. Let's start with the children. Okay. Dr. Vinay Prasad, Prasad, he has a Substack called Observations and Thoughts. This is just a few days ago. Title of his comments, Line Up, Children. The COVID sniffing dog is here to judge you. This was April 24th, 2023. He says this, a recent paper in JAMA Pediatrics. JAMA is the Journal of the American Medical Association, and JAMA Pediatrics is the journal specific to pediatrics. A recent paper in JAMA Pediatrics shows how badly adults dehumanized children. Here's what researchers did. They trained the dog to sniff out COVID-19. Then they lined up kids in school. Kids had to stand 6 feet apart. They had to face away from the dogs who smelled their ankle. If the kid had COVID, the dog would sit down. Then all kids got tested with Binax, a COVID test, rapid, and researchers could see how the dog did. It strikes me as a bit dehumanizing to treat children like this. Seems that lining them up in the schoolyard and having a dog sniff them, something I have only been subject to in airports where I assume they're sniffing for bomb residue or drugs, is a bit extreme. I worry how a child might feel if they go to school feeling fine and the dog sits down beside them. Their classmates, even though they are told to face away, will still know the dog will stop moving. And let's be honest, kids will look around. Did they pull the kid from school then? Did any kids start crying? Seems messed up to me. Why did they have to do this with children? Why do I note this? Says Dr. Vinay Prasad, a highly regarded physician. He said this, if we're going to do this, let's do it for doctors or nurses, or at least adults. It is kind of effed up to treat children like this, and future generations may look at us like we are out of our minds. That's the children. That's one angle where we need to have that axe of accountability chop away at whatever conduit or pathway that we devised that we thought we could do that to children. Let's go now from the children to a man. No name calling. Within the last few days, there was a very long interview in the New York Times with Dr. Tony Fauci. And the interview is conducted by Mr. David Wallace Wells. It is a very long interview, but Jeffrey Tucker, a highly regarded writer and speaker, broke it down. And he said, I've got some top 10 quotes from the New York Times Fauci interview. Let's go over it. So here's what Jeffrey Tucker pointed out. And I'm not going to point out all 10. I just want to talk about some that I thought were pretty remarkable as well. Number one, Fauci says this, something clearly went wrong, and I don't know exactly what it was. We are the richest country in the world, and on a per capita basis, we've done worse than virtually all other countries. That was his quote in an interview. Fauci on vaccine mandates. you had people who were on the fence about getting vaccinated, thinking, why are they forcing me to do this? And you have that smoldering anti-science feeling, a divisiveness that's palpable politically in this country. That's what Fauci says. Here's what Jeffrey Tucker says. If you didn't think you needed the vaccine or didn't trust it, Fauci proclaims that you are responsible for divisiveness and an anti-science feeling. The independent streak he refers to, according to Tucker, is called freedom. Another one. Fauci on why he's not responsible when people say Fauci shut down the economy. Fauci said this, but show me a school that I shut down and show me a factory that I shut down. Never. I never did. Okay. So Dr. Tony Fauci is telling the New York Times your interviewer, David Wells, he never did that. Does that remind you a little bit of the recent news with Prime Minister Trudeau in Canada? He comes out and said that he never forced people to take vaccines. And yet, if you look at the tweets that are out there, you will see straight out, he said, we're working with mandates because that's what we do. That's the way to get things done. But now he's saying, no, I didn't do that. Maybe Prime Minister Trudeau needs to check back with the truckers' convoy and see if that's the way they remember it. Next one. This is again from the New York Times interview. Fauci on the effectiveness of masking. Masks work at the margins, maybe 10%. But I think that anything that's instigated or intensified the culture wars just made things worse. And I have to be honest with you, David, the interviewer. When it comes to masking, I don't know. Okay. What did the Yeshiva World news program say about that comment that Tony Fauci made to the New York Times interviewer? The headline article is Bold-Faced Liar. Fauci contradicts himself, now says masks work only 10% of the time. And it goes on to say, Dr. Anthony Fauci has been the biggest cheerleader for masks and their associated mandates over the past 3 years. In the face of scientific evidence and research suggesting that masks were ineffective when worn by the general population, Fauci initially dismissed their usefulness. And I remember that well. February, March of 2020, no, don't wear them. No, you don't need to. Just save them for the healthcare workers. However, without any new randomized controlled trials or evidence to justify a change of opinion, Tony Fauci suddenly flip-flopped, promoting masks as a necessary tool. He defended indefinite mandates and forcing children to wear masks. New York Times interview, he admitted that masks don't make a dent in the fight against COVID. And this article in the Yeshiva World, April 26, 2023, says, from a broad public health standpoint, at the population level, masks work at the margins, maybe 10%, Fauci said. That's unmasking. Next one. Fauci on not understanding the virus. Quote, herd immunity is based on two premises. One, that the virus doesn't change, and two, that when you get infected or vaccinated, the durability of protection is measured in decades, if not a lifetime. Jeffrey Tucker goes on to say, hold it now. And this is what he says. To be clear, nothing about herd immunity requires lifetime immunity, and it certainly is not premised on unchanging viruses. It's an established reality that such widespread and mostly non-deadly pathogens like this COVID virus mutate, which is precisely why they cannot be eradicated through vaccination. Why must anyone have to explain viral basics to Fauci of all people? Then Jeffrey Tucker highlights another quote by Fauci in the New York Times article. Fauci on the huge age gradient of medically significant risk. Quote, did we say that the elderly were much more vulnerable? Yes. Did we say it over and over and over again? Yes, yes, yes. But somehow or other, the general public didn't get that feeling that the vulnerable are really, really heavily weighted toward the elderly. Like 85% of the hospitalizations are there. I'm going to weigh in on this one, Tony Fauci. I think people understood quite well that, yes, it was the frail elderly that were most at risk. That's why we were so horrified to see patients in nursing homes locked in without the value of their loved ones watching over their care, consoling them. Rather, you and your policymakers locked them in a box and said, your facility is infested. We're not letting you come out. And we know that you knew very well that most of these people were going to get sick. And for sure, it was the frail elderly that were at the greatest risk. Another one, Fauci on whether the NIH funded the lab that leaked the virus. Now you're saying things that are a little bit troublesome to me, Fauci says. This work was done in order to be able to help prepare us for the next outbreak. And it was judged that this type of research was important. Is that why you dodged and weaved when it came time to answering the question about gain of function? You said there was no gain of function research. I think that's been substantially repudiated. And number 10, by Jeffrey Tucker regarding the New York Times interview with Tony Fauci. Fauci on gain of function research. Some want to pass a law. All gain of function should be stopped. But if all gain of function stops, you will have no vaccines for flu. You will have no vaccines for any of the other diseases because all of that manipulates a virus or a pathogen to gain a certain function to be able to make a vaccine. Jeffrey Tucker says in his article, that's a very hard claim. And I think it's quite ingenious that Jeffrey Tucker did something that I would not have thought of to do. He decided for a response to that, he would go to these new artificial intelligence programs. So he went to ChatGPT, and it quickly spat out the following. So Jeffrey Tucker feeds ChatGPT the information Tony Fauci has said and says, can you give us an answer? And here's what artificial intelligence says. And I don't know that artificial intelligence really has a hard right or a hard left political leaning. Here's what artificial intelligence said about Tony Fauci's comments. No, the flu vaccine does not require gain of function research. The development of flu vaccines typically involves studying the behavior of the virus and its strains, identifying the most common strains, and predicting which one will be most prevalent in the upcoming season. The vaccine is then developed using inactivated or attenuated versions of the virus, which do not require gain-of-function research. Gain-of-function research, which involves genetically modifying viruses to make them more infectious or deadly, is sometimes used for studying the flu virus, but it is not required for the creation of flu vaccines. In the future, Tony Fauci might want to have ChatGPT stand in for him at some of these press conferences. Jeffrey Tucker closes with these comments. Fauci and his friends keep trying to close the book on the COVID era. They have settled on the messaging and are doing everything possible to tie it all up in a bow in hopes that everyone will move on. The mainstream media wants to move on too. Everyone guilty for the wreckage wants to do the same, particularly the elites in every sector that pushed for and celebrated the mass violation of human rights. That would be looking at the man, Tony Fauci. We talked about the children. Now let's talk about a profession. Let's talk about my profession, the medical profession. John Mandrola, he has a Substack called Sensible Medicine. This came out a few days ago. The title of it, The Uncertainty of Clinical Trial Results. And he points out the problem that has literally infected the medical profession in regards to our literature. Now, there is an effort out there to charge authors in order to get their articles printed in journals. Substantial, hefty fees. We have had situations previously where researchers would do a project, and if the results didn't if you will, satisfy the source of funding for that study, oftentimes that research conclusion would simply be shelved and hidden away. Numerous high-quality journals said, okay, listen, if you want us to publish your results when your research is done, then you have to register your research with us at the beginning, and you must report the results at the end, so there can be no cherry picking of which data gets put out there. In my profession, we're having a problem, and I think we're going to have a hard time solving it. I think it's more likely that you must help us solve it, and I have some ideas on that. So this article says, clinical trials are supposed to give doctors answers to major questions. Which chemotherapy regimen might be best for you for your chemotherapy? Would you be justifiably a heart transplant candidate even though you have these other medical problems? Would a kidney transplant work for you despite the fact that it didn't work for a sibling with end-stage kidney disease? All these kinds of questions are what rumble around in our heads. It's difficult. There's hundreds of medical journals. And so in the medical profession, we have learned to lean heavily on certain high standards, the New England Journal of Medicine, Lancet, BMJ, and then you have your specialty journals as well, your cardiology journals, your nephrology journals, your surgical journals, and all that. But we frequently will use the Cochrane Review, C-O-C-H-R-A-N-E, the Cochrane Review. Oftentimes they'll do meta-analysis where they'll try to take 50 to 100 studies, look at them all, and tease out the overarching conclusion. The Cochrane Review did that. They did it for masks. And here is what this article by John Mandrola, The Uncertainty of Clinical Trial Results, quotes. The authors of the Cochrane Review wrote, wearing masks in the community probably makes little or no difference to the outcome of laboratory-confirmed influenza/SARS-CoV-2 compared to not wearing masks. I told you I had an idea that might help you. I know it's going to take some homework on your part, but you need to put 3 capital letters in the Google box and study them. NNT, the number needed to treat. What that basically is an opportunity and a way for you to determine whether or not a recommendation regarding your healthcare makes as much sense as it might sound. I'm not going to go into too much detail right now, but I will tell you this. The data that allows a pharmaceutical company to interrupt the football game at halftime and tell you that if you take this medicine, you can reduce your risk of heart attack by 40%. Under a different set of lenses, a different speaker to the issue, that same data can be demonstrated to show you that for every 50 people who take that drug for the 5 or 10 years in order to prevent a heart attack or whatever, for every 50 people who do that, 1 will achieve the benefit that represents the endpoint, avoiding a heart attack or avoiding a cardiac death. So 1 out of 50 or 2% will be spared that devastating outcome we're trying to avoid. That same data can be used on TV by a drug company to say, if you do this, you have a 40% reduced likelihood of heart attack. It's a little complicated, but frankly, folks, I don't see how you can do anything other than more boldly take charge of your own health. Then we're going to go from the profession of medicine. I want to talk about the public health agencies next. What have we seen happen during the course of this pandemic? Well, I would suggest this after reading many articles, and I specifically reviewed the novelty of mRNA viral vaccines and potential harms. It was a scoping review by Dr. MTJ Halma, H-A-L-M-A, January of 2023. Reviewed that and numerous other articles, and this was my conclusion. There's been a desultory performance of public health agencies, and this is the major problems that I see as I look back on the last 3 years. First, we have harmed people in dozens of ways through bad policies. 2, we've undermined long-standing vaccine schedules. I said this years ago, that if you fracture the public trust, you'll see downstream consequences that you would not necessarily have anticipated. We're seeing it now across the board. We're seeing it nationally. We're seeing it internationally. Vaccines that have been strongly and conventionally adopted by parents and societies and large groups across the board, tetanus, diphtheria, measles, mumps, rubella, the administration of these vaccines has dropped off. And it's because of the way the immunization programs were rolled out and treated during COVID-19. I checked the CDC this morning in terms of where we're at. I believe that right now, 16% of Americans have had the boosted, up-to-date response that they're looking for. 16%, which means some 84% have not. That means 1 out of 6 Americans are going along with what the CDC is recommending. Right now, I think the context really matters. We have about 3,000 counties in this country, the United States. We have 3,000 counties. I believe right now we have something like, in the last week, I think we've had some 1,500 COVID deaths. That would be 1 COVID death for every 2 counties in the nation. I think it's important to recognize that during that last week where we had 1,500 COVID deaths, we've had about 70,000 Americans die, because just about 10,000 Americans die every day. So if we have 1,500 COVID deaths and 70,000 deaths, we're probably somewhere around 1.5% of the deaths are being caused by COVID. More than 20% of the deaths would be caused by heart disease. Approximately 20% of the deaths in America are caused by cancer. But right now, we're seeing 1.5% of the deaths in America being related to COVID. And that's assuming that the death certificates are being completed correctly. Next one, we have seen potential applications of mRNA technology harpooned for the future. Make no mistake about it. The vaccine programs that have been rolled out for COVID-19 have been problematic at a level never before encountered in the United States history regarding vaccines. But mRNA technology does have potential great application and merit. To be able to put in a set of instructions that might allow our immune system to consistently attack a cancer cell. In the world of science, before we really get to a place where things work out super, sometimes we stumble and bumble. But mRNA technology cannot be thrown out the window. We have got to use that in the same way that we use CRISPR technology, stem cell technology, transplantation technology. I remember the days where the diagnosis of leukemia was virtually a death sentence. But gee, the number of times we can do bone marrow transplants and cure people, it's huge. This is a real problem that our society is going to take such a broad-based, dismal view of mRNA technology. We're going to have to look at that for genetic disease resolution, Gaucher's disease, any diseases where we're missing a vital protein or enzyme. Next thing, we have seen a fractured trust in future response recommendations. I don't mean to be sarcastic here, but frankly, if Tony Fauci came out and told Americans they should all go out and buy a dog, I think it'd be just likely that you'd see a run on goldfish at the pet store. We've seen the patient-doctor relationship absolutely gutted. And we've seen clinical trials undermined. That's what we've seen at that public health level. So we talked about the children. We talked about the man, Tony Fauci. We talked about the medical profession. We've talked about the public health agencies. I think it's time to look at an international setting. Let's talk about how are we sitting with other first world countries in the world. Tony Fauci said we did worse than all of them virtually. David Zweig, on April 27, 2023, said, yet another European study contradicts CDC doctrine. And he goes on to talk about a study from Finland, which found that masking young kids in schools did nothing. And then he asks the big question. Why has the CDC insisted otherwise? And then he goes on, quote, this is David Zweig, ZWEIG's article from his newsletter. In a recent interview, Anthony Fauci said that at the population level, masks work at the margin, maybe 10%. Fauci's somewhat heretical admission comes on the heels of a new study from Finland, which found school mask mandates for younger children did nothing. The question worth considering is, why did the CDC and much of the general narrative in the United States part so dramatically from Europe on this topic? First, to the Finnish study. The authors of the study write, face mask recommendations in schools did not reduce COVID-19 incidence among 10 to 12-year-olds in Finland. Then David Zweig continues to talk about studies, and he goes to another study. He said, matching the Finnish results, a study in Catalonia, Spain, that included nearly 600,000 children, where those aged 6 and older were required to wear masks in school, and those 5 and under were not. That study found no significant difference in transmission between the two age groups. And then David Zweig asks these questions. Why has the CDC director, that'd be Rochelle Walensky, and so many public health professionals in the United States spoken with such certitude about the benefit of school mask mandates? Why did the U.S. recommend masks for children all the way down to 2 years old? And here he comes in with his closer. To my mind, perhaps the worst mistake in the United States during the pandemic was the hubris of the health authorities and professionals who made unwavering pronouncements about the supposed beneficial effect of certain interventions. He's right. That hubris, that excessive confidence, that cocky attitude that nobody knows as much as I do, or Tony Fauci facing the world and say, if you don't follow me, you don't follow science. Had health authorities spoken with more humility and expressed the uncertainty of the evidence, they would have garnered far more confidence from the public. That's the Finnish and the Catalonia, Spain studies. In 2020, there was an extensive article done by Swiss Policy Research, June of 2020. That was 3 years ago. Recently, a month ago, they came out with an update on it. In it, they mentioned all kinds of policy decisions regarding COVID. First, lethality. In terms of the infectious fatality rate, it's going to be about 0.1 to 0.5%, in the same ballpark as a medium influenza pandemic, such as we saw in 1936, 1957, and 1968. Age profile, the median age of COVID deaths was over 80 years of age. Vaccine protection, rapidly declining protection. We all know that this virus mutated quickly, and one vaccine didn't necessarily get the next strain downstream. So we end up with the Omicron variant not responding at all to the initial vaccine, which was created against the wild strain. Vaccine injuries. I don't think there's any question. The CDC will acknowledge that there's been more injuries reported to this vaccine than all the other vaccine injury reports over the last 20 years combined. Excess mortality. Looks like it's going to be about 15% to normal global mortality increase. Symptoms. 30% of all infected people showed no symptoms. We talked about that 3 years ago. It's pretty much stayed the course. Treatment. Earlier prophylactic treatment. I think we've got a lot of homework to do there. Long COVID. Up to 10% of symptomatic people experience long COVID symptoms. I'm not terribly surprised by that. When I think of some of the other viruses that afflict humans, I think of the Epstein-Barr virus with mono, and I think of the chronic fatigue syndrome being related to the Epstein-Barr syndrome, Epstein-Barr virus. So I think we're going to learn more about long COVID, but I'm not optimistic that there's going to be any magic silver bullet that's going to take care of the concerns that so many people might be having, and I feel really bad for those folks that are suffering from long COVID. Masks. I think the Cochrane Review and many others, including now Tony Fauci, have said they didn't do what you had been told they might do. I think one of the worst things we did was telling vulnerable people, wear a mask and you don't have to worry. I mean, that's tantamount to putting them at danger, real danger. Contact tracing. what can we say? The government was going to go in and start tracing you even if you didn't know it, even if you didn't want it, even if you didn't give them permission, they'd do it off of your phone. Thank heavens for Sweden, right? I mean, Sweden had the courage to go ahead and do it the way they saw it, and they performed about the same level as or better than many countries, and they did not go with the school lockdowns, and they did not go with the business lockdowns. The Swiss policy research, I found that real helpful. And I want to close with my comments on, now that we're talking international, I want to talk about this article, April of 2023 in the New York Times by Mara Vistendahl and Benjamin Mueller. Title of the article is China's Censors Rewrote the COVID Story. I think in the final analysis, I hope that we're getting to a point where we can recognize that there was control and power and corruption and dollars driven by this entire pandemic. For those physicians who think that they or their institutions, their hospitals, their clinics are above massaging how they code things, I hope you enjoy the world you live in. I think that dollars do control an awful lot of what we do in medicine. I don't think it's any surprise or any confusion as to why we've passed laws in the past in the 1990s, I believe the Stark Amendment nationally, where we tried to make certain that there was an arm's length transaction so that physicians could not own the CAT scans or the MRI units to which they would refer patients. I think when a clinic buys a mammogram machine, I think what you're going to generally see is the utilization of that mammogram machine will be encouraged. I don't think that's rocket science. But again, if people can comfortably say that dollars don't impact on doctors, congratulations for living in that world. I don't live there. But anyway, getting back to this article, just going to highlight some things about China. And I've not been a big China basher, but this article is compelling. Early in 2020, a team of scientists from the United States and China released critical data showing how quickly the virus was spreading and who was dying. That was early 2020. A team of scientists from the United States and China. But within days, the researchers quietly withdrew the paper, which was replaced online by a message telling scientists not to cite it, not to refer to it. What is now clear is that the study was not removed because of faulty research. Instead, it was withdrawn at the direction of Chinese health officials amid a crackdown on science. One of the authors said that the Chinese government muzzled scientists, hindered international investigations, and censored online discussion of the pandemic is well documented. But Beijing's stranglehold on information targeted international journals and scientific databases, shaking the foundations of shared scientific knowledge, a New York Times investigator found. Under pressure from their government, Chinese scientists have withheld data, withdrawn genetic sequences from public databases, and altered crucial details in journal submissions. Western journal editors enabled those efforts by agreeing to those edits or withdrawing papers for murky reasons, a review of over a dozen retracted papers found. This is the New York Times article. And there's a paragraph in here that's particularly cutting because I remember it so well. I remember, I think December 29th or 30th, 2019, when there was a report that 6 or 8 patients suffered from an odd respiratory illness in China, and it was being investigated. Within a few weeks, we were learning more about COVID. And the doctor's name was Dr. Li. Full name was Dr. Li Wenliang. But I remember he came out, and then I remember all of a sudden he was gone. You didn't hear a thing from him. But here, the New York Times brings back a little bit of closure to this. You might not have known this. On February 6th, 2020, so we're just barely into the pandemic, when averting a pandemic still seemed possible, the Chinese internet lit up with the death of Dr. Li Wenliang, the Wuhan doctor who had been punished for warning about the outbreak before falling ill himself of COVID-19 and succumbing to the illness. Anger boiled over. Across China, they asked how many had caught the virus in December. Who had known? Why hadn't more been done? The Chinese government reacted by tightening online censorship and wresting control of research. Soon, Chinese researchers were asking journals to retract their work. In the end, there's a reason for the headline of this article. The World Health Organization has only added to confusion about the pandemic's origins after errors were found in a major March 2021 report from the WHO organization and China. This was a report from the WHO and China. A WHO agency spokesperson, Tarek Jazarevic, promised that officials would correct the mistakes. 2 years later, they have not. And that's why the New York Times wrote an article saying China's censors rewrote the COVID story. So here we are. Now it's our turn. We don't need to rewrite the COVID story. We need to recognize that an act of accountability has got to chop down those conduits whereby Americans were too readily deceived, discouraged, disparaged. Too readily did we see corruption and control being the rule of the day. I can't help but think about the childhood story I used to hear so long ago when my mom and dad taught me about Jack and the Beanstalk. And I remember that the only way that Jack could stop the giant, that evil, terrorizing giant, from coming down the beanstalk and capturing him was for him to chop the beanstalk down. And he did. And the giant fell to his death. And Jack and his mom and his community lived happily ever after. Well, folks, we need to chop down the conduit by which so much went wrong for not just America, but across the globe. This is not a time for contempt for one another. This is a time for accountability, understanding the context, getting better prepared in the future. For those people who want to do personal attacks and call people names, I have no particular regard to talk with you. But I think we can do better. There's so much happening. I hope this review of all things COVID is helpful. The X of accountability is chopping away. Thank you.